My heart's like 107.
I got a smile on my face. Hey, everyone. Welcome to the Green Nurse Podcast, monthly clinical conversations where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. And I'm sure you've heard me say this
And
a
it's
few
the
times.
H for
hope,
hope,
I for
inspiration,
G for
growth,
and H for
healing.
And guess what?
That's what we do.
It's okay to feel good. Everyone deserves to feel good, and so do you. So happy June, everyone.
Yeah.
Happy Father's Day month. Happy Pride month. And we just got back from a conference.
AHNA, yeah. So the American Holistic Nursing Association up in Rochester, Minnesota, got to see the Mayo Clinic and all of the goodness of Rochester, and met lots of nurses. There were about 500 nurses in attendance in that conference. You know, they have about 5,000 members. And the cool thing was that they had an entire cannabis nursing track. And Miss Sherry Mack here rocked it several times with her keynote speech on therapeutic use of cannabis, which we might hear soon in an encore presentation, as well as safe use and consideration with Dr. Deanna Summers, and then cannabis assessment with the entire board, which was a lot of fun.
Yeah, and then Deanna presented on scope and standards.
Yes, she did.
And then Nicole Ryan rocked it with her presentation on what is the endocannabinoid system. And then on the last day, she did an amazing presentation, I heard, on sacred plant healing medicine. So really, really exciting. And then I want to give a big shout out to the nurses that came with us.
Yes. So we also had a table. So Holistic Caring and the Green Nurse and Bloom Hemp had a table at AHNA. And Nurse Denise and Nurse Heather Meehan were both with us and really rocking it to represent us. They're both cannabis nurse health coach graduates of our program. And working with Bloom Hemp with their clients. And so it was really a joy to get to know them more and to have them in the table with us. And, you know, really to sit back and enjoy the conference myself a little bit more and attend everything while they manned the table. And I thank you so much.
Yeah, it was great.
Yeah.
So we're going to get into our show. So May last month marked Mental Health Matters Month, a dedicated time for raising awareness, fostering mental well-being, and supporting individuals grappling with mental health hurdles. So we're going to unite today and to prioritize mental health, even in June, dismantle some stigma, and advocate for enhanced mental health services for all. And last month, we were very lucky and privileged to be able to collaborate with This Is Jane Project, which is a nonprofit organization empowering women and non-binary trauma survivors by fostering community and empowerment. And we presented on therapeutic use of cannabis for mental health. And so mental health issues affect men and women differently, and societal pressures often deter men from seeking help. And this is Men's Health Month, and it's Father's Day coming up. So according to the National Institute of Mental Health, men are less likely to seek treatment for mental health disorders, which can lead to severe consequences. Factors such as societal expectations, cultural norms, and the fear of appearing weak contribute to this reluctance. So this month's newsletter at Holistic Caring and at the Green Nurse and Bloom Hemp centered around men's health. And so we're going to be sharing in a few minutes. I'm going to pull up the deck. If you guys look in the comments, there is a link to our newsletter. And I'm going to share that really quick now. And Elizabeth's going to talk about our newsletter.
Are we going to go through that, or
just real quick?
Okay.
Yeah, we'll go through.
All right. We'll go through the newsletter first then.
Happy June.
So
happy
yeah,
Father's
and
Day.
happy Father's Day to all the men. And men, you know, we all share the same health concerns, but men, do they want to go to the doctor? No. So a lot of the things that they're doing is really just some neglect. Men need to go to the doctor, know their numbers. We've talked about this for Men's Health last year. Really knowing your weight, your blood sugar levels, your blood pressure levels, your cholesterol levels, etc., so that you can make sure that you're doing things. One of my heroes, Dean Ornish, put out a guide to physical and mental wellness, and it's really a wonderful guide. There's a link right here to it, and you can really just get some great health tips from him, who has led millions of people. But it's not just, the lifestyle efforts of nutrition, rest, connection, and movement. but also adding in CBD. You know, we talk about this as a shortcut for many people, men and women alike. Unlike THC, CBD does not have psychoactive effects, so it's a very appealing option. When we talk about, you know, cardiovascular health, which is really the number one killer of all of us in America, but men really have an issue with that. And, you know, sometimes it's poor diet, lack of activity, high stress, high blood pressure, high cholesterol. So that's why you need to know your numbers. And then you need to work on the Dean Ornish principles to lower those and get yourself back into health. But cardiovascular health, when we're talking about CBD, it may add some additive effects. CBD is very anti-inflammatory and protective. It's neuroprotective to our brain, cardioprotective to our heart. THC is a little tricky and may cause tachycardia and heart issues.
We're going to talk about that.
Yeah, in high doses. So you want to use that sparingly and with caution. When it comes to the prostate, you know, many times we're looking at prostate cancer. A lot of men face that as far as well as BPH and some hyperplasia. And what we're finding in the preclinical research and actually some clinical research now is that CBD has an anti-proliferative effect and can lower the inflammation, helping to keep those prostate numbers good as far as PSAs. As well as shrinking prostate tumors and making sure that they don't proliferate other places, and also improving blood flow to the area, which may help for sexual functioning. Managing stress and sleep. We know that CBD is really good for stress. You know, when we look at stress is number two, follows pain as number one, and bringing people to cannabis and CBD therapeutics as an option to replace pharmaceuticals and help us deal with life more. So CBD can help lower the set point, help us downshift from stress, maybe help you not reach for the booze as much and hit the beer as you get home from work. Take a dropper of CBD and go for a walk. And then also helping your sleep patterns by impacting the circadian rhythm and reducing anxiety so you can sleep.
Yep. And so then we're going to talk about too the potential impact of CBD on physical health and mental wellness. And we're going to actually get into details and slides here. But CBD is known for its anti-inflammatory, pain relieving, muscle recovery benefits, and may maintain exercise performance for day and night, coupled with stretching, meditation, yoga. Men are combating signs of aging and bolstering their sexual health due to enhanced overall well-being. For sure. So this newsletter here is at Holistic Caring and the Green Nurse. We also have a similar newsletter on Bloom Hemp. We have the link in the show notes down below for you all to see that. And we are going to, let's just remove this for now.
And in the conclusion there, it mentioned advanced focus during the day and advanced trilogy at night.
Well, we're going to talk about that.
Yeah, we're going to get to that in a little bit. So.
Yeah. And so, you know, we're back. You know, the Green Nurse Podcast Clinical Conversations webcast came about when Nurse Elizabeth and I merged our companies, Holistic Caring and the Green Nurse, alongside of Bloom Hemp, creating Holistic Caring Network. And Clinical Conversations explores all aspects of how to optimize cannabis as medicine. People are making great medicines. People are selling these amazing plant formulations, yet no one is truly interpreting how to use cannabis as medicine. And that is what we do as clinicians in the space. Mm-hmm. So, Elizabeth, we have a sponsor. Who's our sponsor today?
Bloom Hemp, as you all know, it's woman and nurse owned hemp CBD supplier, grown USDA organic hemp CBD from the mountains of Colorado, leading with quality, safety, and doing the right thing by having a nurse line that's free. And you can call 970-404-HOPE or 4673. You can also email info@bloomhemp.com and also go to the services tab where you can get a free care plan. And you just do a little bit of an intake form, and then we'll email you back some product recommendations with the rationale on why that might work for you, as well as some personalized lifestyle tips. And as always, Green Nurse, all caps or even just all lowercase, gives you 10% off plus free shipping.
All right, there we go. Okay, so I am going to remove this, and we are going to add the slides, and we're going to get started on our presentation here.
Perfect. Yeah, I know they're all waiting for. I love clinical conversations where we actually just really break things down for people and put this into context.
Yeah.
into our busy lives.
And so when we started off the presentation, we started off with the high video, and we'll start off with that as well today.
Okay.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope.
Remove. Okay, there's technical difficulties you can't hear, and I'm not sure why.
No audio.
So no audio, but it's a great video that we'll put in the link for y'all to watch. But let's just get started.
We have audio. We work.
Yeah, so basically, this is just a great little clip that we start off with. Hope, inspiration, growth, and healing. The first thing that cannabis brings so many people is hope. Hope that they can have a better day. Hope that they can live their best life. Hope that they don't have to suffer. Hope that, just truly hope. And once they have that hope, they have inspiration. And once you are inspired, you're in spirit, right? And you're open to receiving information. Hope, inspiration, growth. Growth is an action word, meaning that you actually have to do something to grow and to heal. And the last letter for the high is the healing. Hope, inspiration, growth, and healing. And healing isn't the absence of illness or disease. It's truly doing the best you can with what you have in any given moment. So this Cannabis for Mental Health resource guide, this was created by the Green Nurses at Holistic Caring to educate and empower you to make choices that are best for you. And so this was a guide that we created for This Is Jane project. And we're going to kind of switch it over to This Is John. This is John today, right? So, and it's a guide. If you're looking to treat symptoms of illness, use cannabis as a wellness tool, or even have a safe adult use experience, this guide will help you to find the way. And then when we talked about it, this is just my introduction. My name is Sherry Mack. I'm a registered nurse, cannabis patient advocate activist. I've been in the cannabis arena, since 2014 when I found cannabis as medicine myself and was able to come off of 18 pharmaceuticals. Really grateful to have this opportunity to share this information with you all.
And me, so I'm Elizabeth, and I had the same date, 2014. I crashed my bicycle, and I started taking CBD, and learned how helpful it was to me to not only help me heal from that bicycle accident and surgery, but also from things that I was struggling with for a long, long time. And as you can see, I've been in healthcare just about 40 years, if you count my candy striper years during high school. 8 in hospitals and almost 20 in insurance companies. And then the past 10 in working around the cannabis space. Once I healed myself, I said, if I can heal me, I've got to help others. And so it became a moral imperative for me. And I've been quite busy ever since, writing a book and that becoming our programs, and then merging with you and taking this to the next level. So, so safe use for mental health and well-being. That's what we're here to talk about here today. Mental health and cannabis have long been intertwined. People have always used it to have that downshift and to feel better about their day, really. Not necessarily the problems, but to be able to promote the relaxation response, which gives you a different lens to be able to attack your problems. And when you relieve anxiety, stress, and depression and the day-to-day angst with cannabis products, you can have trial and success using these various products and move your way towards better living, healthier living, and more balanced living. Some people deem this as recreational use, but cannabinoids act as potent modulators of our neurochemistry and affect us long after use, assisting our healing process. So it's not just when you use cannabis, but it's actually the ongoing benefits. We call them side benefits instead of side effects, side benefits to using cannabis. Positively influencing our mind and spirit affects our physical health, because if we don't relieve stress, it accumulates in our tissues and causes inflammation, illness, and disease. Mental health is physical health, and physical health is mental health. And you want to have a mutually reinforcing way to approach this. And then, of course, dosing matters, and so do your choices on how you use cannabis. And finally, you matter. You have to matter.
Yep, absolutely. And so this slide here is just I love this slide. Thank you, Dr. Yue Blushing, for allowing us to use this. This was taken from the Cannabis Health Index, and it's also on the Canna Keys. And so the endocannabinoid system is a conductor. It signals both the fight or flight response and the relaxation response. The fight, flight, freeze, fawn response is involuntary. We cannot control it. I don't know. Try to talk someone out of having a panic attack.
It's hard.
Right? It's really hard. But the relaxation response requires conscious awareness and practice. And so the relaxation response is where we rest, repair, and it fosters resilience. And when we're able to step into the relaxation response, hormonal signaling changes, calming the sympathetic nervous system, and providing that homeostasis and balance for amongst all of the other systems. So stimulating the relaxation response can be done in multiple different ways. We can use cannabis or hemp. We can do mind-body induced. Those are the holistic modalities. Relaxation, Tai Chi, Qigong, meditation, awareness, mindfulness, exercise. And then we can combine both, using both cannabis and mind body together. And that's what we do as nurses, is we teach how to pair cannabinoids with health and wellness activities, pairing it with lifestyle as medicine, so you can have an optimal outcome when using the plant.
Yeah, like I said, you take one puff, maybe a 1-to-1, and then go for a walk. Look at the trees, look at the birds, and just get into nature, because that heals. So self-love and self-care. No one is going to take better care of you than you.
And that's including all of you men, right?
Yes,
we need you to love yourselves. There is nothing wrong with that.
So why don't we take better care of ourselves? Well, we think self-care is selfish, or that strong people don't need it. And that is especially for men. We think we haven't earned it, or we don't have time for it. We have an external locus of control. We don't see ourselves as in charge. Somebody's always the boss, telling us what to do. We feel like we're reporting to them. But discipline and abstaining are needed from the feel-good things, from the hedonistic living, because we just want to feel good now. And so that's also a balance. I just want to kick back and go on the couch after and I always say, don't go from the car to the cubicle to the couch. You need to exercise. You need to move. And you also need to abstain from the junk food. And Sherry has a fried food.
Is what it is. Avoid fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oils, high fructose corn syrup, sugar, and alcohol.
Yeah. And so abstaining, but also discipline in constructing a good, healthy life, and cooking and preparing healthy, nutritious meals. It takes more time, but it's worth it to feel good. So there's a solution, right? Become a gatekeeper for a precious child. You are precious. Keep in the good friends, nutritious food, peaceful sleep, healthy activities, enriching learning, appropriate challenges, love and support from family and friends. Keep out manipulative people, alcohol, tobacco, mindless TV, and realize that you are your own precious child. You are in control of you and your best self. So you matter.
You do. Here we go. Self-love. This is just taken right from the dictionary.
Mm-hmm.
Regard for one's own well-being and happiness. You matter. There is no one more important than you, and no one is going to take better care of you. The other definition is a state of appreciation for oneself that grows from actions that support our physical, psychological, and spiritual growth.
So it's a snowball approach.
It is.
Right? So, all right, pivoting into cannabis and how this is going to help our well-being. Well, there are 3 types of cannabinoids. And what is a cannabinoid? It is a molecule. It's a compound that is going to activate the endocannabinoid system. The endocannabinoid system is an internal regulating system that we all have in our body that keeps us in balance. We think about it as the Goldilocks zone. Not too hot, not too cold, not too warm, not too, just right? And so through feedback mechanisms and corrective actions, these cannabinoids are always giving messages and correcting cell signaling so that we just operate better. So the endocannabinoids are the ones we make endogenously. Anandamide and 2-AG are the 2 most famous ones that we talk about, but there are a couple more. But those are the ones that this plant, phytocannabinoids like THC, can actually mimic. And if you look at THC and the molecular structure of anandamide, they fit right in that nerve cell in the endocannabinoid system. So the phytocannabinoids are the external cannabinoids that the cannabis plant makes. And we've always been grazing animals and munching on this plant and absorbing this plant, and through inhalation and topicals and salves and extracts for thousands of years. And these plant compounds also nudge this system back to health. And we'll talk about deficiency, because if we're not making enough of our own, we can supplement with this plant, just like we do vitamin D, bring us back into balance. And then there's synthetic cannabinoids. Those are the ones that the pharmaceutical companies are making. Marinol or dronabinol is synthetic THC, and it's on the market for chemotherapy-induced nausea and vomiting and appetite stimulation. There's also Epidiolex, which is purified CBD, and that is given to kids with rare seizure disorders. And then there's Sativax, which is a good one-to-one oil where we have equal parts CBD and THC, and that's on the market in pretty much the entire British Empire, about 30 countries around the world, but not yet here in America. But the endocannabinoids, they keep us in that Goldilocks zone and activate these cell receptors on the membranes of all of our cells, just about every single one of them. And they restore balance and allow downstream healing. Because if you correct the air, then everything below that is going to operate on a better milieu. Now, when we talk about THC mimicking anandamide, it's about 10 times stronger. So the thing is, why are we not high all the time? Because our endocannabinoids are synthesized. They do their function, and then they dissipate in microseconds. Yeah, on demand in response to stress. And then the phytocannabinoids, they float around the systemic circulation, activating these receptors all over the place. And when they lock onto a receptor, they can be on there for hours, depending on the route of administration. But once you get enough of these phytocannabinoids in the system, then it can do that work. But it's about 10 times stronger. So that's why you feel it from the plant, whereas you don't necessarily from your own, other than triggering the runner's high, which through good exercise, cardiovascular exercise, you can feel your own anandamide running through, and it is Sanskrit for bliss, ananda. So
Ananda hum.
Yeah, some good stuff there.
Yes. So we're going to talk about anxiety in cannabis. So anxiety is the number 2 reason people use cannabis as medicine, with pain being the number 1 reason. So when we're looking at anxiety and treating cannabis and using cannabinoids, there's truly a biphasic approach where low doses do one thing, high doses do something else. And we have a couple of slides that are going to show the THC,
especially THC,
specifically with THC. But when we're working with consumers, right, we educate on how it interacts with these different other neurotransmitters. So the serotonin neurotransmitter signaling system, CBD acts on the 5-HT1A receptors, stimulating serotonin, lowering anxiety, and promoting antidepressant and anti-anxiety effects. Dopamine in particular, CBD acts on receptors, boosting dopamine, the happiness neurotransmitter, enhancing reward and motivation. CBD also inhibits the breakdown of the Fa enzyme, helping to retain some more of our own anandamide molecule, the THC-like molecule in the brain, areas involved in anxiety and fear, calming those regions. And we're going to talk about this in an upcoming slide, but too much THC can cause anxiety, or CBD can soften THC without taking away the medicinal effect. There is a huge discrepancy. A lot of people say, oh no, I don't want to do CBD. It's going to ruin my high. No, it's going to soften it just a little bit so you can tolerate more. A lot of consumers that we work with need high dose THC, but they need to balance it out with CBD so they don't have the anxiety. And so when we're educating, we teach to use full spectrum CBD products in the daytime, folding in minor cannabinoids such as CBG, CBN, CBDA, CBGA, THCV, THCA, using small amounts of THC to microdose through the day. And studies actually confirm that full spectrum CBD is the first choice for managing anxiety. That's chemo type 3, more CBD than THC. Full spectrum CBD products are available in all 50 states.
Mm-hmm. So on the flip side, depression. So the endocannabinoid system modulates all of these brain regions that have to do with our anxiety, depression, our stress, etc. And the ECS and the endocannabinoid dome, the larger environment, are involved in the pathogenesis and the treatment of depression. So how we get it and how we heal it. Cannabis can stimulate CB1 receptors in the brain, the prefrontal cortex, the amygdala, hippocampus, and that helps neurogenesis, neuroplasticity, and promote new cell growth and learning. So the amygdala is our emotional centers, our sort of our midbrain, our lizard brain, the automatic, right? The fear centers. The hippocampus is our memory centers. And we want to have those balanced. And when we are remembering trauma, when we're remembering bad things, we can get depressed. We can trigger greater levels of depression. But activating these systems, because if we're not making our own endocannabinoids, this is left without having that balancing effect, right? So now we bring in CBD, we bring in microdoses of THC. We can activate these receptors in the amygdala to soften the fear, hippocampus to let go of some of those aversive memories, and then we can also stimulate new nerve cells and new learning, which is the neuroplasticity, to unlearn some of that thinking and move forward. So pro and antidepressant activity have been reported after the use of THC cannabis. And that's like I just said, more favorable responses are seen with CBD dominant formulations of cannabis or hemp CBD. Too much THC can make depression worse. And we have seen that.
Mm-hmm.
People are trying to treat depression, and a little bit can be okay, but too much actually makes depression worse. Low dose THC increases dopamine, improving mood, motivation, and the relaxation response. So we want to keep it low. CBD stimulates over 70 targets in the body, including dopamine, serotonin, and boosts our own anandamide by inhibiting the enzymes that break it down. Our own bliss molecule to help mitigate those symptoms of depression. So even if you don't want to use THC, just using CBD is going to help you preserve anandamide, and anandamide is going to go to work in these centers in the brain. Dose similar to managing anxiety with CBD dominant products, folding in minor cannabinoids like maybe THCV to give you a little bit more energy as well, CBG to soften inflammation in the brain, CBN to help you relax, and then microdoses of THC.
There we go. Okay, insomnia and cannabis. Really, really interesting. You know, I work with a lot of people that have issues with sleep, and I'm trying to get people to understand that your sleep hygiene starts the minute you open up your eyes in the morning. Truly. Everything that you do in the daytime or don't do in the daytime is going to affect how you sleep at night. So literally, when we're working with consumers that have issues with sleep, you know, you want to get up in the morning, you want to get that sunlight, you want to go outside, get sunlight on your face, and the eyes as well. To stimulate the pineal gland, to stimulate your own melatonin production. Also want to do some grounding as well. Eat, sleep, relax, forget, protect, right? These are all things that the endocannabinoid system modulates. And our job is to also choose health and wellness activities that support that. So when dosing for insomnia, we teach on educating on using whole plant formulations, using full spectrum CBD, CBG, THCV, and energizing terpenes in the daytime for energy and focus, keeping THC doses low in the daytime to prevent daytime drowsiness. In the evening, we suggest using full spectrum CBD, CBN, and sedating terpenes, adding in more THC in the evening with a 1-to-1 formulation in a tincture, gummy, or inhalation. Choosing, if you're going to inhale, choosing indica dominant THC and CBD products to enhance the relaxation response and improve efficacy. Oftentimes, when we're looking at people that have sleep issues, one of the things I'll ask is, do you have a hard time falling asleep? Do you have a hard time staying asleep? Do you have nightmares? Do you have a sleep disorder? Do you actually have a diagnosable sleep disorder, sleep apnea, or do you require wearing a mask? And so basically, when we're working with consumers, we teach bedtime stacking to facilitate all of these different areas of sleep. So really what's nice is topicals to massage CBD and terpene-infused lotions, creams, or body butters to stimulate the relaxation response. So it's just another self-care mechanism. Giving yourself a massage, rubbing your feet, rubbing your face, actually doing vagus nerve exercises as well. Oftentimes consumers sometimes people just have difficulty falling asleep. So inhalation is really great for falling asleep. 1 to 2 puffs of THC indica flower or indica CBD flower to help you fall asleep. Sometimes.
What terpenes are in indica?
Oh, indica couch. So some of the terpenes that are in indicas, we look at myrcene and linalool. Beta-caryophyllene are pretty much the primary terpenes.
Yeah, those are the ones that. So if you're shopping in the dispensaries, look for those.
Yes, and then also tinctures is another way. So oftentimes I'll teach someone how to stack. Let's put your topical on. Let's do 1 puff. We'll do a sublingual tincture to help prolong the effects of inhalation. So I teach consumers when they're doing tinctures is your mouth is a sponge, a big giant sponge. You have a vein underneath your tongue called the sublingual vein. And so part of it gets absorbed underneath your tongue, but a lot of it gets absorbed when you swallow it in your digestive tract. It's just a little bit longer acting than inhalation. And then edibles, gummies and capsules have a longer acting properties to help you stay asleep or get back to sleep easier if woken up. And so oftentimes if people have difficulty, they wake up in the middle of the night, one of the things that we recommend is we do have Bloom hemp calming tincture to stimulate the relaxation response. It's just a tiny bit of CBD and CBN, a trace amount of THC. We don't encourage people to take edibles in the middle of the night.
No, because you don't want to wake up drowsy.
No. So either like a microdose of a tincture or a 1 or 2 puffs in the middle of the night to help you get back to sleep, and it helps prolong that sleep, that relaxation response.
Exactly.
To get deep restorative sleep. And then we're going to talk about PTSD.
So, yeah, PTSD, you know, everything that we've been talking about thus far with respect to anxiety and depression, same thing with PTSD, which is just exposure to chronic and severe trauma and stress. The endocannabinoid system is involved in processing of fear, stress, aversive memories, emotions, and resulting behavior with relevance for patients with PTSD. The ECS is a target to treat mind, body, spirit, and promote the relaxation response for healing. Patients with PTSD have lower levels of anandamide, our own endocannabinoid system molecules, and that's because chronic stress erodes this system. So that's oftentimes people are like, how do we run deficient? Well, we're aging, we have poor diets, we're not exercising, but also chronic stress is probably one of the biggest mitigators of deficiency.
And chronic stress causes inflammation.
Yeah, and it causes inflammation, which further compromises us. Reduction in our own endocannabinoids, anandamide and 2-AG, is associated with retention of those aversive emotions and memories, frequency of nightmares and suicidal ideation. And preclinical data finds that CBD reduces fear expression and enhanced fear extinction, which produced lasting reductions in fear states in test animals and in humans. I've worked, keep going to the next slide, with many veterans. And, you know, we've talked about this, you know, activating the CB1 receptors in the amygdala, calming those fear centers, calming that fight or flight, and then also subduing those aversive memories in the hippocampus. And this is proven now, and we're also doing some testing and clinical trials with veterans at UCSD and the VA. And PTSD shows enhanced CB1 expression as receptors are upregulating, seeking the endocannabinoids to balance the mind. We also see this in CB2 receptors being upregulated. And what that means is that they're more expressed on those cell membranes, looking for the endocannabinoids to come in, provide that feedback to balance things out, because the cell isn't always smart, but the system around the cell is. But if that system is compromised, which the endocannabinoid system can be, then we run askew. ECS deficiency over time can cause structural changes in the brain following long periods of stress. And we do see this when we're looking at scans and MRIs and PET scans, especially of brains of soldiers with PTSD. So anyway, treating it. THC activation at CB1 in small doses may begin to heal the damage. CBD reduces the anxiety and depression by activating serotonin, our feel-good neurotransmitter, calming the nervous system and lifting our moods.
Yep. And working with consumers that have PTSD, it is truly a multimodal approach, not just one thing, but bringing in lifestyle and various cannabinoids. Because a lot of times when people have PTSD, they also have issues with anxiety, with depression, with panic disorder, agoraphobia.
Well, and PTSD is sort of, it encompasses all of them.
Yeah.
I mean, you're anxious, you're depressed, and this also brings in stacking as well. So we don't want to over rely on inhalation, because, you know, when we're talking about inhale, exhale, and showing a cannabis joint, that is what most people think about, you know, especially vets that just want to smoke.
We use inhalation as a PRN.
Yes, and as a way to immediately lower that stress response in a crisis, but then using oral and sublingual routes on a mainstay.
Well, I can give a story.
Okay.
I'm going to share a story. So I have history of PTSD, and one point in time, this was a couple of years ago, someone was trying to break into my house. I had just finished a podcast. Someone was literally pounding on my door. It was a woman that she had some substances on board, not sure what, literally pounding on my door saying that I had her baby and she was going to kill me.
You called
And
the cops.
yeah, I had to call the cops. So basically, I didn't open the door, but my car was open and she started to go through my car, take things out of my car. I felt my PTSD coming, like literally rearing its ugly head. And I'm generally a fighter. So I'm not a flighter, I'm a fighter. So basically, it would have been very, very dangerous for me to open up that door and fight this woman. So I called the police. And while I'm waiting for the police to come, I literally brought out my bong. And I had already had cannabinoids on board. So I'd already had my CBD, my CBG, my CBN. I take nutraceuticals, supplements, but I needed something to modulate the stress response immediately. And inhalation, and that's when I used it. So it was I literally just very calmly just packed the bong, did 2 puffs, and it was able to calm me down enough. But then I got panicked and I got nervous because the police were coming over. Right? So I have house filled with smoke, and I literally took out my medical card, my medical cannabis card. And when the officers knocked on the door, of course, it's like a Cheech and Chong, smoke everywhere. And I just basically told them, I said, I have my medical cannabis card. I do have PTSD. And this was something that I needed to consume with to modulate my stress response. So I didn't open up that door and fight this woman.
And that's another teaching moment. Always keep your medical card. Even in Massachusetts and California, where we have recreational access and adult use, you want your card just in case you ever have to interface with law enforcement, just in case the employment drug screening comes up positive. Well, you have your card. And in California, you can no longer discriminate against people for that as well, as long as it's off the job.
Yeah.
So,
but my whole point in using inhalation was it would have taken too long for a gummy, a capsule, an edible, a topical wouldn't have worked. It was the inhalation that worked immediately to downshift that stress response. So I could please stop, pause, listen, exhale, accept, silence, and be empowered and do something that's not going to hurt myself or anyone else. Yeah. So that's PTSD.
So psychiatric medications and cannabis. When I was in hospitals, I was working lock psychiatry and dealt with a lot of these, but many people, in fact, 1/4 of all people are on antidepressants in America now, adults. And so SSRIs and SNRIs increase the blood levels of our neurotransmitter serotonin and norepinephrine, and they can help us feel better and actually keep the serotonin in the system longer by preventing the reuptake from the cells. So serotonin's released in between the cells and it stops it from being basically reabsorbed. So it's circulating more longer. So we have Zoloft, Paxil, Prozac, Lexapro, and Celexa on the SSRIs, and Effexor and Cymbalta on the SNRIs. Then to calm people down, anxiety is a huge issue. Benzodiazepines are somewhat of a first line of treatment, along with other things like Buspar. But anticonvulsants can also be used. So Ativan, Valium, Klonopin, Tegretol, Depakote, Xanax, Neurontin, and Lyrica.
All with bad side effects.
Yes. And then for antipsychotics, now we're talking about PTSD, schizophrenia, but more and more they're also being used for severe sleep disorders as well as dementia. And these can stabilize thought disorders and psychosis and work on several pathways: serotonin, dopamine, adrenergic, cholinergic, and histamine receptors. So Clozaril, Seroquel, Risperidol, Zyprexa, and Abilify, these really have horrible side effects and a black box warning. So all of the elders that we're putting on these in nursing homes really need better options, which is why we use cannabinoids for that too, but that's another show. So cannabis dosing, when you are going to take these together with the pharmaceuticals, you always want to space them. Take the pharmaceuticals first, allow some time for the body to clear them, and then take your cannabinoids, your oral, your edibles, your gummies, your capsules, and your tinctures. CBD, 100 milligrams a day or less, or 20 milligrams a day or less of THC, and divided doses can be used safely with most of these drugs. But as always, you want to monitor. Work with a cannabis clinician to optimize the dosing and the plan to reduce some of these other pharmaceuticals. And, I've had patients come to me over the past decade of doing this work saying, I've been on, Paxil for 40 years or something similar for 40 years. 60-year-old person with Parkinson's as well. And he found a pathway to freedom over time. It took about a year. But you can come off some of these drugs when you incorporate lifestyle and cannabinoids.
All right. We got that one there. Okay. This is another handy dandy slide. So interactions with pharmaceuticals. So cannabinoids usually intensifies the effects of pharmaceuticals, right? And when we are discussing here, when we're working with consumers, we always look at the free interaction drug checkers at drugs.com and Drug Bank Online. This information was taken from Cannakeys and looking at the difference between pharmaceuticals with CBD and THC. So CBD can alter the metabolic enzymes, the CYP450 enzymes. And this makes it possible. So CBD interacts with the enzyme cytochrome, increasing the bioavailability of anti-epileptic drugs such as clozapam and benzodiazepines. So this makes it possible to achieve the same results at significantly lower doses. The same results at lower dosages, so reducing treatment costs and risks of adverse side effects. And so the groups of drugs that are affected, and particularly with CBD, are anti-epileptics, psychiatric drugs, and drugs that affect the metabolic enzymes. They're either inducing or inhibiting. Do you have anything to add to that?
Well, yeah, just potentiation. So whether it's opioids or benzodiazepines, those drugs are made stronger because of the enzyme clearance. And think about the enzymes going through our liver to metabolize these drugs as a little Pac-Man. If the Pac-Man are lodged onto the CBD, then those other drugs are going to have more of a free-for-all and get to be active for longer. Which can increase their potency, which then gives you the ability to lower dosing. And opioids is definitely one of the people that are coming with chronic pain and PTSD, because a lot of these veterans are treating chronic pain as well. Being able to have that opioid dose almost immediately within the first week, and then finding their way to freedom. So this is a wonderful way.
And then we need to be a little bit more cautious with THC in particular, because THC enhances the effects of drugs that causes sedation and oppress the central nervous system, such as the benzodiazepines, barbiturates, and alcohol. So, THC is metabolized again in the P450 inhibitor of several enzymatic liver pathways. And so clinical observations, there's no likely interactions with pharmaceuticals as long as the daily dose of THC is less than 20 milligrams a day, and the same with CBD, less than 100 milligrams a day. Mm-hmm. I love this slide in particular because this actually does demonstrate the dose-dependent biphasic nature. Low doses do one thing, high doses do something else. And these were potential side effects. These were also taken from Cannakeys. And what I really like about this here, in particular on the left, so the study that was done in 2020 was looking at childhood epilepsy studies, and they noticed that the side effects was sedation. They also saw that the only adverse effect was diarrhea. The interesting thing about the sedation and the diarrhea wasn't significant enough to stop the consumer or the patient or the child or the parents from actually giving this to the child. So the benefits of the CBD outweighed the side effects of sedation and diarrhea. So clinical evidence suggests that CBD is well tolerated and presents a very good safety profile. Again, interactions with pharmaceuticals should be closely monitored with CBD over 100 milligrams a day. And that's why working with a clinician is so important. THC, on the other hand, is where people can get into trouble. Too much THC can cause drowsiness, dizziness, vertigo, ataxia, tachycardia. So with the older consumers, it puts them at risk for falls. THC can potentiate changes in cognition, memory, attention, and concentration. High doses of THC can cause dry mouth, dysphoria, anxiety, panic with high dose, and also nausea. And the addiction withdrawal potential is less than 1 in 20. Interactions with pharmaceuticals should be closely monitored with THC over 20 milligrams a day. And then we're going to slide over to the right here. So a lot of times, where it's like, oh, the dry mouth, oh, the red eyes, oh, the munchies. Well, sometimes the side effect is the effect that another consumer might be looking for. So the consumer that has Lou Gehrig's disease or ALS that's drooling actually welcomes the dry mouth. The consumer that has glaucoma actually welcomes the red eyes because the red eyes demonstrates the vasodilatory effect of the cannabinoids actually lowering the aqueous humor in the eye, so decreasing eye pressure. The consumer that is nauseated or cachexic or wasting away actually welcomes the munchies, the increased appetite. The consumer that is hypervigilant and has insomnia or even PTSD welcomes the drowsiness, the sleepiness, and the forgetfulness. And then the consumer that is depressed actually welcomes euphoria. Euphoria is not a crime. Dysphoria is at this day and age. And generally, whole plant formulations, microdosing, and working with the cannabis clinicians decreases the potential for side effects.
Yeah.
Anything to add?
Well, and just looking at that THC of 20 milligrams a day, that's high.
That's high.
Right? That's high. So when we start somebody out, it's 1 to 2 milligrams.
Yeah.
Right.
Yeah.
Take a 5 milligram gummy and cut it in half. That's your first dose.
Exactly.
Yeah.
Exactly. We're going to talk about that in here.
So yeah.
What happens when you take too much THC?
Go easy on the THC. So THC and mental health and really just health in general. We talked about cardiovascular in the Men's Health blog. And this is the same thing, right? You want to use low doses. Too little of a dose has not enough of an effect. Too high of a dose increases anxiety and side effects, tachycardia, etc. The optimal dose is that sweet spot. So the Goldilocks system needs Goldilocks dosing. So too much THC can also cause a downregulation in our cannabinoid receptors in our body. The endocannabinoid system is the largest neuroregulatory system in our bodies, regulating all of the 11 organ systems, our immune system, and every other neurotransmitter. And what happens is if you downregulate this system, it works less effectively and efficiently because those receptors are hiding. If there's too much cannabis floating around the system, the receptors downregulate, and then they're no good to anybody. So we want to manage this in that sweet spot. Too much THC can slow down your body's own production of anandamide that we need to activate these receptors, CB1 and CB2. And that's also why we tell kids not to use THC until they're much older and the brain is fully developed. Too much THC impairs our stress response and actually makes stress more. You get higher levels of stress and higher levels of anxiety, changing the impulsivity and the reward sensitivity by changing the dopamine signaling, and causing addictive issues over time. We know that one in 10 approximately get addicted to cannabis or have cannabis overuse disorder and cannabis hyperemesis syndrome. And that's from using too much high THC products and downregulating your own system. And you can have all kinds of issues. But now when we use just small amounts of THC and lots of CBD, now we can walk people away from addiction to other things, which I was going to mention in some of the other slides, but addiction to the opiates, addiction to alcohol, addiction to even tobacco. People are able to let go of cigarettes when they're using good CBD and microdoses of THC.
There we go. And then again, greening out. How many people have taken too much where you don't feel good? Right?
Not fun.
It's not fun. You know, symptoms of overconsumption. You do not feel good. You feel anxious. You may feel paranoid. A lot of times you'll have temperature changes where you'll be hot, you'll be cold. A lot of people will feel dizzy and lightheaded. Some people may feel nausea, have nausea and vomiting, and in rare cases, psychoses. How to manage overconsumption? Call a cannabis nurse. Truly, if you do call 911, what's going to happen is they are going to come to your door and they're going to medicate you with benzodiazepines, antipsychotics, and you're going to get a big slap on your chart, cannabis use disorder. So don't panic. You will not die. We encourage people, to not get into this situation in the first place. But if you do, take a high dose of CBD, 40 to 100 milligrams to help soften the effects of THC psychoactivity. Drink or eat something with sugar in it in case your blood sugar has dropped. Sip on a water-soluble CBD drink. Continue to hydrate with cold water. Suck on lemons, chew peppercorns. There are some products on the market, Undo and olive trawl. I'm going to be doing a podcast in July on a product that's coming out on the market. It's called Undo, which I think is
Soft landing.
Soft landing.
Mm-hmm.
Soft landing. Yeah. So continue to hydrate with cold water. Take a lukewarm bath or shower. Go outside and get some fresh air. Vagus nerve stimulation. And the goal is to get into the relaxation response. Rest and phone a cannabis nurse. We have a hotline you guys can call if you get into trouble.
And the lemons really work the best. In fact, I was listening to Ethan Russo, the great Ethan Russo, talking about limonene and THC and how we have been knowing for thousands of years that lemons can soften any kind of excess from using cannabis.
When we did, big shout out to Denise, when we did our cannication retreat in Maine a couple of years ago, one of the things that they did have was they had lemonade that was terpene enhanced with limonene.
Yep.
So people were able to sip on that throughout the day in case they had overconsumed too much. that was readily available. All right.
And grounding. One of my favorite things that I've discovered after watching a movie called Earthing is earthing. Really, just going outside, putting your hands and feet in the earth. That's a wonderful thing that I have rediscovered and love it. But really, just getting into your senses, and this is specifically to decrease anxiety. Looking at things that you see, the nature especially. Things that you can feel, the wind, touch from another, things that you can hear, going back to the wind, the birds, being able to tune your brain into listening to bird song will absolutely bring down stress levels. Things you can smell, go up and smell those roses, smell that lemon tree and those blossoms. Things that you can taste that lemonade and enjoy that. And then, of course, take calming tincture, which is CBD and CBN with essential oils and terpenes that also are calming.
There we go. Okay. So supporting patients with CBD, right? So CBD is a cannabinoid that's found in both the cannabis and the hemp plant. A lot of our new listeners or new people that are learning about this didn't know the difference that, cannabis and hemp is pretty much the same thing. The difference is the lab results, right? So cannabis has greater than 0.3% THC. Hemp has less than 0.3% THC. The government does have a patent on this. This was 21 years ago. Cannabinoids as antioxidants and neuroprotectants, US patent 6630507, where they had found cannabinoids are found to protect cells, tissues, and DNA from damage and decay, limiting neurological damage following ischemic insults such as stroke and trauma, or in the treatment of neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, and dementia. So currently there's 3 different types of CBD products on the market. You can actually get CBD at a dispensary, but the CBD that we're talking about is those that you're going to find online at the shops. So you're going to see a single isolated molecule, CBD isolate. So that means it's just this molecule of CBD. There is nothing else in there. Then broad spectrum CBD includes the CBD molecule plus the minor cannabinoids and the terpenes, but 0 THC. And full spectrum CBD is whole plant, including all of the minor cannabinoids, all of the terpenes, and the trace amount of THC that is less than 0.3%. So supporting patients with CBD is really the best start for most conditions, including mental health.
And the power couple, we're running out of time here, but we all know that, using THC, you want some CBD on board because it helps soften the effects of the THC. And then THC works better with CBD. All of these anti-nausea, analgesia, promoting better sleep, boosting the immune system, immune modulatory effects and immunosuppression for overactive immune systems, euphoria, promoting the relaxation response, all is credited to THC and CBD helps it work better.
Yeah. Okay, safety and dosing, taking the Goldilocks dose, taking the lowest dose to get the most therapeutic response below the threshold of impairment, starting low and going slow. Microdosing to mimic endocannabinoid system signaling. So breakfast, lunch, dinner, bedtime, and as needed doses. For the newbies, we teach to start CBD-rich formulations in the daytime, THC-rich formulations in the evening as needed. And then for those that have more medical challenges or even tolerance or need more, a balance of a 1-to-1. 1-to-1 is the most therapeutic across all conditions. And then stacking helps to keep cost effective, keeping it cost effective and keeping the tolerance low. Safety with other pharmaceuticals we talked about. Any drugs that interact with grapefruit, we want to dose 1 hour after taking the medication. Journal and track your results, talk to your provider, and call us.
Yeah. So always add in movement and exercise. This is key to mental health and physical health, not just for men, but for all of us. Daily movement is the natural way to decrease symptoms of anxiety and depression, raises BDNF, our brain-derived neurotropic factor, where low levels have been correlated to symptoms associated with depression, anxiety, and PTSD. BDNF is a protein that plays a major role in neuroplasticity and neurogenesis, which is responsible for forming those new neurons in the brain and strengthening the existing connections between the neurons in different brain centers. We have about 11 different centers in our brain, and we want them all connected. This BDNF is the most abundant neurotropin in the adult brain, which has the capability to repair brain damage. And so movement is key to this. Exercise also supports the endocannabinoid dome and the endocannabinoid system, improving cell signaling for homeostasis and balance among all of your other systems. So feel better.
And again, activating the endocannabinoid system and the endocannabinoid dome. The goal is the relaxation response. These are all things that support and nourish the endocannabinoid system. Food is medicine, whole foods, adaptogens, supplements. There's a lot of consumers that we work with that are taking supplements that are actually working, and they're able to decrease their THC consumption. Regular exercise, motion is the lotion. When we've got bones, joints, ligaments, tendons, fascia, and we don't move, they all stick together, right? So we need to move. Motion is the lotion. It stimulates our own anandamide production and upregulates the endocannabinoid system in a healthy way. Meditation, prayer, breath work, mind-body medicine, vagus nerve stimulation, massage and therapeutic touch. Bring your CBD into your massage therapist and have her massage this into you. Acupuncture, chiropractic care, essential oils, aromatherapy, energy healing, Reiki, reconnective healing, sound healing, chanting, music, drumming. These are all that are promoting the relaxation response. Obviously, eliminating alcohol and quitting tobacco smoke, restorative sleep and rest, social connections, laughter and play, cannabis and hemp products. And you can see these are at the bottom of the list. Oftentimes consumers will come to us and say, gosh, Sherry, I tried all of those and none of them worked. I'm like, don't give up on them yet, because that was my story. I tried all of these. None of these worked until cannabis came into my life. And once cannabis came into my life, all of these modalities started to work a lot better because I had an endocannabinoid deficiency that I was now taking care of.
So people are making great medicine, people are selling these medicines, but no one is interpreting how to use cannabis as medicine. And that is what we do here at Holistic Caring and the Green Nurse. Our mission is to relieve suffering and improve quality of life by educating and empowering patients to make informed decisions. Through our innovative ecosystem, we provide the necessary guidance to patients with their journey to optimal health and wellness. Our vision is to improve patient outcomes through cannabinoid therapeutics and other progressive tools through our Green Nurse approved vetted brands and free nurse line. We simplify and streamline how to optimize CBD and cannabis medicine for patients and their healthcare professionals, while we help build the medical door for brands and dispensaries.
All right. And so now here's the wrap up for the newbies that are out there. We also are the owners of Bloom Hemp CBD. Bloom Hemp is USDA organic CBD. We have symptom targeted formulas, a free nurse line, free care plan, free network, affiliate opportunities for wholesale and retail. And then this month we have a coupon at Green Nurse is for 10% off and free shipping. That is our evergreen code. But right now for men, we have men 20 for 20% off all products at Bloom Hemp. And I'll put that code in the show notes as well. Finally, let's just talk about this.
Yeah, we're doing a study. We
just got the results.
We finished the study. I've been saying we're doing a study for a long time, and last week or 10 days ago, we got the results, and we're going to be launching them very soon on our website. But the data is in, and people love Focus. Focus is CBD, CBG, THCV, along with stimulating terpenes, lion's mane, reishi, and yerba mate. So it's all you need to replace your morning coffee and rock that boardroom. Also great for metabolism, energy, and weight loss, but really enhanced cognition. And that's what the study proved. People got about 2.2 hours more of productivity each day. They had a 75% improvement in stress levels. And in their well-being scores.
Yeah, and we did validated
questionnaires. So WHO studies and PROMISE studies and fatigue assessment scales. And so we were in partnership with More Better, who has done many research studies with universities around the country, along with the Kenigma, who got us the participants. Within a week, we were full in that study. And now we're going to be launching some specials through the Kenigma. So if you're a subscriber, stay tuned for some specials.
All right. And finally, subscribe to our newsletter. So we have a newsletter at Holistic Caring and the Green Nurse and Bloom Hemp. You could go to either of those websites. And if you subscribe to our newsletter, we have a 7-page free medical cannabis guide that Elizabeth and I wrote. It's actually very beautiful, beautiful PDF with graphics to teach and educate and empower you to use cannabis appropriately for your health and wellness concerns.
And our ecosystem at Holistic Caring Network is, really unmatched. We have, the previous slide showed patient-centered care, where we put that patient in the middle and then build all the systems that they need, the programs, the nurse mentoring, the coaching for patients, the free nurse line for the patients, and, whatever you need, we have it. The free plant medicine support group, the last Thursday of the month, please join us for that. We have a free introduction to cannabis program. We have a dozen paid programs. Our flagship program is our Cannabis Nurse Health Coach program, which has 3 modules of about 10 units each and 30 units of continuing education for registered nurses. And so please join us. We have a Nurse 25 coupon valid till the end of the month. We'd love to see you in our programs.
All right. And then again, as always, subscribe to the Green Nurse Podcast, hope and inspiration for growth and healing.
Yeah.
And these are our resources that we have on the slide deck. And it has been a pleasure to be with you all. I'm so sorry that the video was not working. I'm going to have to do a sound check on it. We usually end with the video, but since the sound isn't working, we're not going to do that.
Okay.
And remember what it's all about, everyone. It's truly about living your best life and helping others do the same. Thanks for joining us.
Be well, be healthy. God bless.